Welcome to Bruce Hurwitz Presents Meet the Experts. I'm your host, Bruce Hurwitz of Hurwitz Strategic Staffing. You can find us on the web at hsstaffing.com. I hope you'll consider us for all your staffing, career counseling, and speech writing needs. I am pleased to be joined today by Charles Newman. We will be discussing employer-based health insurance. Meet the Experts is sponsored by P&K CPAs. P&K is a full-service accounting firm. They provide accounting and consulting services to businesses ranging from startups to small and mid-cap companies to nonprofits, as well as high net worth individuals. Contact them today for a free consultation at pk-cpas.com or call them at 973-882-8810. They will be happy to be of service. Chuck, welcome to the show.
Thank you for having me, Bruce. Truly appreciate it.
It's my pleasure. Take a moment or two, please, and introduce yourself to our viewers.
Absolutely. Thank you, Bruce. I'm a 30-year veteran of the employee benefits business, and I've seen a lot of changes in that time, but what I've seen mostly is our costs go up for health insurance and other employer-sponsored benefits. So my firm, Charles Newman Co, is comprised of 5 individuals, each of whom has at least 15 years of experience in our business. I have the most of 30 years. And what we do every day for our 200 plus customers is we look for the best options for them for their group health insurance, their ancillary benefits like dental, vision, life, long and short-term disability insurance, and voluntary employee paid benefits that employees can purchase through payroll deduction at the work site. We also assist those same customers and their employees every day in fighting with the insurance companies if need be, to make sure that their benefits, all the benefits that they're due and get paid to them, and that claims are resolved promptly.
Thank you for that. Now, is there any benefit that an employer can offer to an employee that is more meaningful, more important than health insurance?
Interesting that you asked that. I've received many calls recently. It's a very difficult hiring environment. It sounds a little counterintuitive with many people out of work right now, but I'm getting calls from employers who have not, to this point, offered health insurance, and they are looking to offer health insurance specifically because they need to hire employees. Now, in the United States, for the past 10 plus years, there has been an option for individuals to obtain health insurance through marketplaces, through the federal marketplace, depending upon what your state is, what state you reside in, or the state marketplace or exchange. That term is used interchangeably. Mm-hmm. So individuals can get health insurance on their own. However, typically the plans available through the exchanges or the marketplaces have what are termed those narrow networks, where it's very difficult sometimes to find the physicians, the practices, the facilities that you and your family use. So that's why employer-based health insurance is particularly important, because through employers you can get a wider range of options, bigger networks, more choices, and that's what employees typically are looking for. And they're also looking for their employers to subsidize that coverage. So it is important for employers to offer it. Is it the most important? That really depends on the employee. I suppose their salary is the most important.
No, I said benefit.
I said benefit. Yes, it is. I think so.
2 things. First off, the person who contacted you and said he's having trouble finding people is not alone. And all the feedback I'm getting is that because of the high rate of unemployment insurance, why go out and work? The government's paying you to stay at home. But you reminded me of something that happened to me probably 30 years ago. My boss said to me, go and ask a few people if they like our health insurance. I believe we were with Oxford at the time. And I asked him why, and he said, well, we're thinking about changing it, but don't tell them that. Just ask them if they're happy with the health insurance. So I left the office, walked into the lobby, asked one person, went into the men's room. 3 minutes later, I came out. The boss was in the lobby and he asked me, what in the world did I do? And I said, what are you talking about? He said, my phone is ringing off the hook. Everybody thinks that we're changing our health insurance. So that's when I learned that health insurance is a very emotional subject.
It is.
And it's always, what will I be able to keep my doctor? How much will this be? How much will that be? Prescriptions, what have you. And I fully understand it. How do you deal with the emotional component of talking to people about their health insurance?
When we do employer meetings, first of all, every year a health plan renews. And every year the premiums go up. It doesn't seem that they go down ever. Sometimes they stay relatively flat. But so that's a good renewal when that happens. But every year they renew, employers are forced to make choices. Why? Because they just can't keep paying more and more and more every year and have the subsidy that they provide, the contribution that they provide to their employees just keep growing and growing, particularly in an environment, depending upon the business or the industry that they're in, when they can't raise their prices and get more money in the door, but they're still paying more for their benefits. So the way we deal with that is, we'll look at the options. We'll have a meeting. We're doing those in person again, but many of them just had one this morning with a company that's in New York with employees scattered all about the country. So of course that was on Zoom, on a video call. And we explain everything very clearly. We don't try to hide anything, sugarcoat anything. But one of the things that we can do specifically, Bruce, to address that anxiety is to get a list of the folks, the doctors that people use, that the employees use in advance when we're going through this process of review with the employer. And we, by the way, like to start that process at least 90 days prior to the renewal, so we have plenty of time to investigate these things. Get a list of those doctors, see what the match is between the new plan and the new insurer potentially and the existing insurer. And a lot of times it matches up extremely well. We had one group recently where there was a 99% match between the practitioners in the new insurers network versus the existing one. So we try to alleviate that anxiety by going through to those lengths to make sure that the employees are comfortable with the new plan. And then we explain everything, hopefully in a jargon-free environment where we have to use the terms, right? We have to say deductible and co-insurance and copay, but we define them very clearly and succinctly for people. So they're like, oh, okay, that makes sense. I'm good. And we really do, I think, if I do say so myself, do a very well job of a very good job of communicating those benefits well to the employees.
Two-part question. What do you look for? What should be in a health insurance plan, and what should you avoid?
The key really, as you brought up before, is the network. It always goes back to the network. And that's job one, is to make sure that the network is there. After that, most plans today, really all plans, fall into platinum, gold, silver, or bronze in terms of the level of benefits that they provide. That was brought to us by Obamacare, by the Affordable Care Act, the platinum, gold, silver, and bronze. So within the scope of that, it's pretty reasonable to assume between one insurer and another, the benefits are going to be relatively similar from one gold plan from one insurer to a gold plan from another insurer. So it's the network, it's the coverage within the that a particular category, that metal tier, gold, platinum, silver, et cetera. And we want to make sure that if, for instance, the current plan has very rich benefits for advanced radiology, just picking something that comes up very often. Doctors are prescribing MRIs, CAT scans, PET scans at the drop of a hat today. So we want to make sure that if the current plan covers advanced radiology with very low out of pocket, we talk to the employer about that and say, you're paying more for that. Is that something you want to make sure? Oh, yes, we have a lot of people who've had these things prescribed. We don't want them paying thousands of dollars. So that's an important benefit. We want to make sure that in the new plan, again, platinum or gold, whatever it is, that that specific benefit is relatively similar to what they previously had. And we kind of go down the list on those kind of things to make sure that we don't jump into a plan where there are surprises. Never want surprises in health insurance.
How do you get the most out of your plan?
Good question. Excellent question. And this is one that we do some education on. Here's a for instance. One of the things I talk about, and I don't know if our audience remembers Cy Sims, if they're local to the New York metro area, being an educated consumer, being their best customer.
That's right.
I talk to employees about being educated consumers. And I say specifically, you know, you've got a plan, these are the benefits, but you do need to question your doctor when the doctor is telling you, I want you to go have an MRI at such and such hospital. The hospital is the most expensive place to have that MRI. You could go to a standalone radiological facility and get it done for a quarter as much. Now, if you have a deductible for that MRI, if you've got out of pocket for it, you stand to save money by being an educated consumer and not just following what your doctor says blindly, but asking, listen, I know you want me to do it at the hospital, but can I do it at this standalone facility because it'll save me a lot of money, and find out if the doctor is okay with that. The doctor may be, the doctor may not be, but it's up to you to open your mouth and ask. Another point falls to prescriptions, for instance. All prescriptions pretty much fall into different tiers. There's the tier 1, tier 2, tier 3, sometimes tier 4 and 5. Tier 1s are, generally speaking, not always, generics. So that's going to be the lowest out of your pocket. Could be $5, $10, $15, but it's going to be the lowest and typically not subject to any prescription deductible. Once you get into tier 2, which is a brand name that's preferred, or a tier 3 non-preferred brand name, or tier 4 specialty medication, you're going to have a deductible first and much higher co-payments. Those things, you know, flat dollar amount that you pay for those medications. Again, it pays to ask your doctor, open your mouth at the point where the doctor is saying, I think you need a prescription. If you're going to be on that prescription on an ongoing basis, or even if it's a one-off, because prescriptions are so expensive, ask, is there a generic available? And at the very least, what we tell them is, look, if the doctor says, well, I don't know if there's a generic, I don't know if the generic will work for you, then you might want to say, well, look, if you're going to put down a brand name and then communicate to the pharmacy, dispense as written, that's the legal nomenclature. The pharmacist must dispense that brand name. They can't give you a substitute. But if you ask your doctor, don't check off the dispense as written when you're sending it to the pharmacy. Maybe I'll try the generic, see if it works. Is that okay with you, doc? If it's okay, you'll pay that much lower copay. So those are just a couple of the tidbits that we communicate with our groups and try to help them get the most out of their health insurance.
Now, since you mentioned prescriptions, I remember. Commercial now there's GoodRx, and there's another one that I can't remember the name for.
I've seen a couple others. GoodRx is a great option to use. It may help you lower your prescription costs, particularly if you're on a high deductible health savings account compatible plan. Now, this there's often confusion about this because people may think they have a high deductible, and that deductible could be $2,000, $3,000, but it may not be a health savings account compatible plan. Why do I mention this? Because with a health savings account compatible plan with a high deductible, from $1, with the exception of your annual physical or a well woman exam for women, everything goes toward that deductible, including your prescriptions. So you're going to the pharmacy, you're paying the actual cost, a discounted cost based on whatever discounts your insurer has negotiated with the pharmaceutical company or the pharmacy benefit manager for that prescription. But if you use an app like GoodRx, you may even be able to get it more cheaply. And you can still use your health savings account funds. If you funded a health savings account to purchase that, you're just saving a few bucks on it. But it's a great thing. I'm glad you brought it up because it is a great tool for people, particularly those with high deductible plans, which are health savings account compatible.
Let's discuss the worst thing that happens. Your doctor says that you need a procedure, and you call the health, or you call the health insurance company, and they say, we're not covering that. Do you have to take no for an answer?
Our motto is that we don't take no for an answer. And it's even in our company video, Bruce. That doesn't mean ultimately we won't get no, but you need to have a broker advocate for you. And the specific reason I say broker is because generally speaking, unless you're working for a very, very large company, in which case there's still somebody that you hopefully can appeal to. Someone is deriving a monetary benefit from having had your employer purchase that health plan for you. In my world, that's a broker. We're brokers. So we never mind when a HR director says, you know what, my employee's having a problem with this. Can you help them? Absolutely. We want to help them. We want to make sure that they get that benefit. It takes a lot of hoops sometimes. We don't want them stuck in next available customer service associate hell. We want them to go through us because we want them to have hopefully the best experience possible with their insurance. A lot of times we work directly with the doctor's office, have the doctor write a letter of medical necessity, whatever it takes to make sure that that procedure is indeed authorized. And it is very important that you're very cognizant as a consumer of health insurance that everything that you are asking for with respect to anything outside of a doctor's office visit, if it is indeed a surgery or if it is a test, those all need pre-authorization. And we do see insurance companies push back, as you pointed out, Bruce. And that's when, if you're having an issue, you need to enlist the services of the broker for that plan. And if the broker doesn't want to talk to you and doesn't want to hear from you, you need a new broker.
Now, do you have special leverage as a broker, a unspoken threat, a little friendly blackmail? I've got 100 clients and I'm sending them to you for insurance. If you don't say yes, then when it's come time to renewal, I'm not going to recommend you to my clients.
You know, all I can tell you, Bruce, is business is business. Good business is good business. And we appeal to people as human beings. That when you are on with the next available customer service associate, and sometimes they may not even be in the United States, it's very difficult for the consumer to really advocate for themselves. We have people that we can go to. We're in this business. We know what to do. We have the channels. Again, doesn't mean we'll always succeed, but we do push it as far as it possibly can go. And it may include employing leverage, whatever that may be, because we are, I should say, we have substantial business with many insurance carriers. And it's, as I said at the outset, it's just good business to make sure that these things get done. Sometimes it's simply a misunderstanding, a miscommunication. Many times by the doctor's office. The doctor's office did not put in the appropriate form, didn't check the appropriate box, whatever it was, and we get to the bottom of that. So it's not always, it doesn't require necessarily a threat, and blackmail wouldn't be in my vocabulary anyway.
No, friendly persuasion. But you go to the, you said you talk to customer service.
No, I said that typically that's what the employee is going to get stuck.
You don't
doing.
have to deal with customer
No,
service.
we have other channels.
Yeah.
We have what we call escalated service teams, depending upon the situation, whether the employer has insurance that we sold directly with an insurer, or if they're with a professional employer organization, a PEO, we still are able, as a broker, and we are brokers for PEOs as well, we're able to effectively advocate for the employees as long as we have a HIPAA authorization from that employee, they allow us to advocate on their behalf, then we're able to work directly with the insurer for them.
How can employers save money on their health insurance plan?
Great question. So in 46 states, the definition of a small group means that you have 50 or fewer employees. In
50.
I'm sorry?
50?
50, 50, in 46 states. In 4 states, New York, California, Vermont, and Colorado, small group insurance means you have 100 or fewer. Whatever state you're in, if you're in that small group market, 100 or fewer, 50 or fewer, depending upon your state, the rates are the rates. They're filed with that state. They're non-negotiable. The only way you can get lower cost for insurance, there's no magic with respect to it, but there are intelligent plan designs. So the no magic part is smaller networks, more out of pocket. That's how you get lower rates, but that doesn't really help your employees that much, right? So if you want to keep the sizable network with the access that you have, keep your employees out of pocket at a relative minimum, then it's really a question of looking at things like health reimbursement arrangements. A health reimbursement arrangement is a situation where you're going with a higher deductible and higher out of pocket and higher co-pays, but the employer is kind of backfilling that to make up the difference in that deductible, in that higher out of pocket. So it's not passed along to the employees. The reason that that can reduce your premiums is you're going to get a reduction in the cost of the plan for going with that high deductible. But when you're self-funding a portion of that as an employer, you are hoping and betting that not all of that money that you're funding is going to get used. And at the end of the year, the employer is going to carve back the money that wasn't used to pay for those medical purposes. Therefore, that's where the real savings is to them. And we employ that quite often. Another option, if you're in that small group market, are professional employer organizations, PEOs. And if you're in that PEO environment, it's possible, depending upon the demographics of your company, meaning if you've got a lot of young people, you may get much lower rates for your health insurance than if you've got a lot of people who are older age and bigger consumers of health insurance. At the end of the day, you're going to pay a fee to the PEO to administer your plan, but net, you might come out ahead. And that's an exercise we're very happy to go through. It's pretty extensive with respect to the amount of information the PEO is looking for. They're going to want way more than you need to provide when you're just simply shopping for health insurance, because you do essentially need to move your payroll to a PEO. If you're not willing to move your payroll, a PEO is a non-starter. So payroll records, workers' comp loss runs, health insurance, detailed census, they're going to be looking for all of that. If you're in the large group market, again, 50 plus in many states, 100 plus in those 4 that I mentioned, then rates can be negotiable. There is some horse trading that goes along with negotiating those rates. And again, the impact of your demographics, how young your people are, et cetera, claims history, et cetera, will all factor into your rates.
Is there any impact these days on insurance rates if you have a significant, whatever that means, number of smokers or women of childbearing age?
I really don't think so. Where it really comes into, and what for number one, in the small group market, zero impact, zero. If in a PEO, they will look at it, but it's not overriding. What is overriding with either shopping in a PEO or if you're in that large group market would be cancer cases, would be heart disease, would be chronic diseases in general.
Well, that's all pre-existing conditions.
They are pre-existing conditions, but they're conditions which are expected. It's not just pre-existing condition, because there are pre-existing conditions which have already, in many cases, been resolved. They just happened before. These are ongoing conditions and degenerative in nature, where the insurance company pretty much knows, based on years and years of underwriting and actuarial science, what kind of claims they can expect. And those are the situations where insurers will rate up the premiums to compensate them for that. In the United States, in essence, an insurer must pay out 85 cents on the dollar for every dollar that they get paid in premium, 85 cents. Now, we were at a group the other day where for every dollar they paid in premium, the insurer paid out over $2 during the course of last year. $2. So that's not a great business model. The insurer then raised their premiums up 33%. 33% is a whopping increase, but remember, the insurer paid out $2 for every dollar they brought in last year. They're going to try to make a little bit of that up. So once you get to situations where your claims are at 70 cents on the dollar or less, or 75 cents or less, then you're going to do very well in terms of your renewal, your leverage, negotiating with other insurers, because the insurers are going to look at that and say, well, that group's running really well. And particularly if that group also has the demographics with more younger people in it, they're going to get much better rates.
So would it be worthwhile? Would you recommend to employers, excuse me, to have a health program, a fitness program for their employees?
Look, it's never a bad idea to have health and fitness programs. What's kind of been found over the course of many years is that while employee wellness is absolutely something that should be stressed, reducing obesity, smoking cessation, we obviously, it's been well documented, we have a diabetes epidemic in this country, but it's all a net positive, but in general, there's not going to be an impact on your rates, because think about it, it's really more of a long-term proposition when you're talking about wellness. And the insurers are just looking at each individual year and the kind of claims that you're getting. So stopping smoking, great. But if you already smoked for 20 or 30 years, I'm not so sure that there's going to be an immediate impact of that with respect to potential cancers.
Because you've got 2 charcoal bags for lungs.
No comment.
Before I let you go, and now I'm going to put up your contact information.
Thank you.
I have one final question for you. Is there anything that I haven't asked that you would like me to have asked?
Well, I would say, Bruce, that people ask me all the time, what they should contribute. Employers ask me what they should contribute toward their health insurance, to the employee's health insurance. Employees are all looking for their employer to provide health insurance. But what I tell the employers is, well, they're looking for you to provide it, yes, but they're looking for you to contribute toward it, and contribute as generously as you can. We started out today's podcast by you asking me about employers and hiring and how important health insurance is as a benefit in that process. I would say that I have companies, for instance, the HVAC company, heating and air conditioning company, that pays 100% across the board for a very good plan, because they need to hire qualified mechanics, and it's very difficult to find those qualified mechanics. Now, that's very expensive for them to do, but they have to do it in order to attract and retain the employees that they need to. So one key question that we didn't discuss yet really would be helping an employer to figure out, which is something that I do, my team does, what the right contribution level will be based on their industry, based on their needs, and based on what they can afford.
I forgot to ask it, but how important is it that the health insurance be not just for the employee, but also for the employee's immediate family?
Oh, that's a given, quite honestly. Many employers just contribute for the employee, and employees with dependents have to pay the difference, which is very, very common. But providing health insurance at all tiers for employee and spouse, single parent with children, 2-parent family with children is essential, in my opinion, if you're really looking for health insurance to be viewed as an employee benefit.
Chuck, thank you so much for coming on.
Thank you for
provided a wealth of information, and I know our viewers appreciate it.
I appreciate the opportunity, Bruce. Thank you for having me.
It's been my pleasure. Thank you all for watching, and as always, please stay focused on success.